Skin damage. From smoking and lifestyle choices to overexposure to the sun, we are our own worst enemy. Fortunately, medical technology is constantly looking for ways to reverse the damage. The latest tool? A resurfacing laser that combines both Fraxel and CO2 technologies.
This laser is an ablative laser, which means that there is tissue that's removed. You may recall several years ago, and still to this day, ablative procedures are very popular because they are so effective for removing wrinkles and skin tightening and reversing the effects of aging on the skin. And those procedures, fully ablative, could be broken down in three ways. One of them is dermabrasion, which mechanically removes skin down to a deeper layer. Deep chemical peels, such as the phenol peel, and the erbium or CO2 ablative lasers. All of those procedures require an operating room environment and considerable downtime. This is a true hybrid laser. It's one of the first ways that I am aware of that you can convert this ablative procedure to more of an office-based procedure, thereby decreasing downtime.
The Fraxel CO2 laser was only recently released, so it can be difficult to find. But not surprisingly, Dr. Burns and his colleagues at DPSI had an early look at the technology.
We were able to do a clinical trial to investigate the safety and the efficacy, or how well does this particular laser work, over the course of the past year. With that prototype laser, we were able to establish treatment guidelines, which we now use in practice. What it does is it drills teeny tiny holes, about 2,000 per square centimeter. It leaves tissue intact between the treated areas, which allows for rapid healing and also decreases in downtime. So with this particular treatment, a patient can go back into their makeup on an average of 3 days, whereas with the old ablative technologies, the surgical dermabrasion, not the microdermabrasion, the deep chemical peel and the erbium or CO2 ablative lasers, a patient really couldn't go back into makeup for about 2 weeks.
Dr. Burns says the Fraxel CO2 laser is particularly effective for crow's feet and the area around the mouth.
Those perioral wrinkles, we also call them smoker's lines, are extremely difficult to treat. And with the non-ablative modalities that we've had in the past, such as the photofacial or intense pulse light devices, the ability to treat the perioral wrinkles or the smoker's lines is pretty limited. With this Fraxel repair laser, I'm very impressed with the results in that difficult to treat area. I believe, because of its effectiveness, will become very popular in the future.